So for me as a clinical academic at Leeds, my job is split between clinical delivery, treating patients in a hospital setting, as well as the academic side, which is primarily research and education. I have been lucky to be part of a well-established dental materials research group, trying to address key questions that we have been faced over the last few years when it comes to restorative dental materials. So a few years ago, a big question was raised in relation to amalgam use, and that was following the introduction of the Minamata Convention that calls for the phase down in the use of mercury. Now, this applies to everything in industry, but also applies to dentistry. So the question was, what can replace amalgam as a direct restorative material when amalgam is phased out? The way we choose our restorations or clinical solutions or techniques is based on evidence-based practice that is primarily based on really solid scientific research as well as clinical research and outcomes. Therefore, research in dental materials is really essential for me to understand what's out there. It's an ever-changing field, and every day we're faced with new materials that come into the market. Having that sound research behind it really supplements my clinical decisions. So I successfully developed a novel fluoroapatite containing resin composite material that is stronger and also have the unique potential to resist caries around it. And that's because current composite restorations fail due to either fracture or caries. So by addressing these two main reasons of failure, we've successfully developed a material that could potentially replace amalgam and fill that gap when amalgam is phased out. My aim is to try to continue our research and collaborate with the industry partners to take this technology forward, to introduce the next generation of resin composite materials that can potentially replace amalgam.